This is Lori Goldman, Orientation Coordinator at Skokie Hospital. I'm going to show you how to get into and around the OR. The employee parking lot is located on the corner of Gulf and Knox. There's a huge parking lot on your left-hand side. After you park, you're going to head towards the hospital. You'll enter the hospital right underneath the walkway. You'll walk past the emergency room to get to this entrance. You'll need your key card to get in. Turn left at the alcove marked stairs and go up to the second floor. Exit through the door to your right, through the one that doesn't have the ID badge reader by it. After you go through the door, take a left. The locker rooms are at the end of this hallway on both sides of this picture. Your ID should work to get scrubs. If it doesn't, call the front desk at this number. There are 5 lockers in each locker room for anesthesia trainees, so you should be able to find an empty one. You should have the combinations and your contacts on your phone under Skokie Hospital. After you get your scrubs on, go out the other door in the locker room, not the one that you came in, and then you'll see this hallway. This door is where the lounge is. You can drop your lunch off here. If you didn't bring your lunch, we've got a cafeteria on the first floor that's open from 7 a.m. to 7 p.m. So when you come out of the lounge, you want to take this door to come out to the OR front desk. You'll want to head left, and straight ahead is the PACU and the holding area. These are the double doors to the PACU/holding area. You're now standing in the hallway of the odd-numbered ORs. This is OR 3, and you're going to be heading left past OR 7 to pick up your narcotics. The anesthesia pyxis is right behind this door. This little alcove is located between OR room 7 here and OR 9, which is that way. You'll pick up your narcotic kit here, and at the end of the day, you return it to the pharmacy, along with the filled out paperwork that's included inside of your kit. You'll get a narcotic kit for the whole day, so when choosing the patient's name, pick the first one, which is the anesthesia provider kit. For the medication, type in ANE to pull up anesthesia narcotic pack. There's a white form inside the narcotic pack that you'll use to record what each patient received. Put any leftover narcotic syringes in the blue bag that's included inside the pack. Before you go set up your room, you'll want to stop in the anesthesia workroom. It's located in the middle of the hallway on the even side of the operating rooms. You'll want to pick up a Vocera, which is located here in the back. One quick note about the Vocera. It's designed to be left hanging on your shirt. If you pick it up to speak into it, it'll have a hard time understanding you. Right next door to the workroom is the anesthesia monitoring room. You can find the attending mailboxes here. The next thing you'll do is go to the anesthesia board located right between the workroom and the monitoring room. You'll want to put a check mark next to your name where the red arrow is to let the coordinator know that you're here first thing in the morning. The coordinator uses the space under the blue arrow to assign breaks and lunches. If your OR has a break between cases in it, make sure to check here to see what breaks you've been assigned. We use EasyCall to mark off that breaks are completed. Go to the home screen of our EasyCall. We put the app on your phone during your orientation. Click on the coffee cup icon that's circled here. This screen will pop up with everybody working that day's break status. The lunch basket circled in red means that person in room 7 hasn't had lunch yet. If you were assigned to give lunch there, click on that lunch basket and the icon will gray out like the one that's circled in gray. This lets everyone know this person has had lunch or is getting lunch. If you click one more time, it'll turn yellow, which means you should get your own lunch, or you can click it yourself if you think that there's a possibility you can get your own lunch. The other thing that you'll be doing if you're not busy in the OR is to help with post-ops. You'll know they're not done yet if the post-op sign is hanging on the board with the red side of the magnet up. When you're done doing the post-ops, you'll sign your initials and turn the red magnet to the green side to let everybody know that the post-ops are finished. Please don't ask to leave at the end of your day if the post-ops aren't complete. We don't want the call people staying to complete as they're going to be here late already. And now you'll head back to your OR to set your room up. We have a lot of equipment that's different than Rush's OR. There's instructional videos posted on Easy Call for all the equipment here shown with a blue arrow if you haven't used them before. There's our fluid warmer, our bear hugger, our propofol pump, and the Fabius anesthesia machine. We have 2 computers in each room shown by the red arrows. The one that's attached to the anesthesia machine is used for intra-op epic, and the computer on wheels is used to look up your next patient. When you first start up the computers in the morning, you'll see this screen. Be sure to follow the instructions by pressing Control-Alt-Delete to unlock the computer. Don't click the button by the red arrow that says Switch User, because we don't want you logging in at this point with your own username and ID, because you'll lock other people out from being able to use this computer. This will be the next screen that you see. The password that you'll use is unlock11, with the U being a capital U. After this, you'll see the Epic icon and you'll be able to log in with your own username and password. The anesthesia cart will already be in the OR when you arrive in the morning. The drug tray will be covered in plastic. It's very important to remove the plastic when you set up your room. Pharmacy won't restock these trays if the plastic is still on. It's perforated down the middle to make it easy to remove. It's required to date, time, and initial each drug that's drawn up here. These white stickers will be on your anesthesia cart each morning to help make it a little easier. You just have to initial them. For propofol, just cross off the expiration time that's on the sticker and change it to 6 hours from the time the propofol is drawn up. At North Shore, we keep all the empty vials from medications drawn up for each case until the patient is dropped off in the PACU. This way, if a med error is suspected, we can go back and look through the vials. We standardize syringes here to prevent medication errors. Please put your Versed, fentanyl, and lidocaine in 3 cc syringes. Nothing except rocuronium should go into 5 cc syringes. There's a lockbox in each anesthesia cart. Your narcotics should be locked up whenever you're not in the room. The key has a wristband to make it easy to carry it along with you. The CO2 analyzer is separate from the anesthesia machine and must be turned on when you come in the morning. There's a reminder taped on all of the monitors in the ORs on how to chart 3 specific medications: Toradol, Ofirmev, and antibiotics. Each of these drugs needs an order placed so that they are able to be charted under the active tab in the medication section. This way, it's going to show up in the MAR so that patients won't be given an accidental overdose. When you bring your patient into the room, the first thing you want to do is make sure that Epic is attached to your monitor so it can record all the vitals. To do that, you have to pick your macro first, and then the other buttons will display. Then the anesthesia start button will pop up, so you can click that. Then hit the Verify Patient Start button. Then this screen pops up, prompting you to scan the patient's wristband. You'll use this device on top of the anesthesia machine to scan the patient's wristband. If for any reason you couldn't get the scanner to work, just click Override and choose one of these reasons as to why it wouldn't work. After that, you'll be able to take care of your patient as usual without worrying about the charting, because everything will automatically go over to Epic now. At the end of each case, disconnect the monitor from Epic by hitting the Verify ID Band button and scan the wristband again. Okay, so now that your room's set up, it's time to go find your patient so you can do the pre-op. There's 3 places where they could be. First is the holding area, one of the places that we do our blocks. The color on the status board will be purple, and this circled patient is in holding bay 2. The other place we do blocks is in a special area of ASU called Fast Track. This patient circled in black is in Fast Track Bay B. All other patients that don't require blocks are in the rest of ASU. The patient circled in red is in ASU room number 8. So the first place that I'll show you out of those 3 places where your patient could be is the holding area / PACU. As you'll remember, it is straight through these double doors right next to OR3. When you walk through those double doors, to your left, you'll see these 4 bays set aside in PACU, and we call this the holding area. We do the blocks here before patients go back to the OR. On this side of the hallway is where we keep all the supplies for the blocks. Right across from Bay 3, you'll find the anesthesia block cart. It has everything needed for the blocks. Ultrasound machines and patient positioners are also around this area. A little further down, you'll find these 2 carts. This little one is the IV A-line start cart. Most of the patients will already have their IVs started by the ASU nurses, but you may need to start one if the patient is a difficult stick or maybe if they need a second IV for potential blood loss. The blue cart that's next to this is the anesthesia supply cart. It's very similar to the cart that is in the ORs. So if you have an emergency in the holding area / PACU, this is the cart that you're going to want to wheel over. If your patient is in ASU, you'll go back outside OR3 and go down this hallway through the double doors. You'll find the fast track area of the ASU first. Take a left under its sign. You'll find your patient in bays marked A through F, along with all the equipment to do the blocks. The rest of the patients will be found in the other section of the ASU. To get there, walk past the fast track area and turn left at the window. Just follow the signs to your patient's room number. The ASU rooms are all private with their own bathrooms. You can find your patient's chart in this bin on the wall. When heading back to the OR with your patient, be sure to bring the chart with you and leave the door open so that the ASU nurses know that the patient is gone. When your pre-op is done and your regional block is completed, you need to make sure that you drop your A from the status board. This is how we communicate with the other members of the team to let them know that we're ready to bring the patient back. All first cases must be in the OR by 7:30. If not, we don't want to be the reason that they're late because it gets written up. So make sure you've got time to get your block in after your room is set up and the pre-op is completed so that the patient gets in that room by 7:30. I hope you have a great first day. If you have any questions, ask any attending or CRNA.